What's good, y'all? It's the Demouchets React, and we're back with another video. Who we got today, C?
Today we're back with another American reaction. So excited about this video. If you're new to us
And we're new to you,
make sure you scroll down,
hit that subscribe button,
and turn on the post notification bell
because we're on the road to 200K.
And we cannot get there without you guys, all right? Join the family. Without further ado, let's get into the video.
Let's get it.
What do you think about socialized healthcare?
I do not like the idea of that.
I don't want the government picking what I can and cannot do.
Well, my husband's from Europe, so I think it's pretty good, actually. I think a lot of people are covered by it. Everybody's covered. They don't have to worry about paying for it.
It's definitely more accessible for everybody. It allows all of us to remain healthy, to live long lives as much as we can.
I think it's kind of a necessity that the government provides health care for its citizens.
If everybody has something for free, who's going to pay for it?
Okay, what if people pay for it by taxes? What do you think of that?
Well, that's going to increase. Do you like to pay taxes?
So first of all, let me ask you, do you know what the NHS is?
No.
They regulate and provide national health services for the UK.
What do you think the average copay is under the NHS?
I can't imagine it goes any lower than 30.
The amount for me is like $120 to see my family physician.
And so based on that, what would you guess would be the price there? Similar?
Probably, I would say probably higher.
Higher?
Mm-hmm.
It's actually, there isn't a copay, so it's $0. Do you know if you get healthcare if you're not a citizen, do you think, under the NHS?
Let's talk about it. I feel like there's some pros and cons if it relates to you. Like, the tax is based on your income, right?
Right.
But there's no copay. So it's like, it's a pro and a con at the, but also what I have been reading, like from y'all in our comment section, is that there may be months until you can get into your doctor. So y'all let us know. That's true.
Yeah.
Right, let us know if that's true in your country. Because I mean, like, there's some things that I like about the idea of it, but then if I need to go to the doctor and it's not something serious, it's just something that I'm concerned about, I want to be able to schedule that appointment as soon as possible.
Yeah, and you're able to do that. You don't have to wait.
Right.
So what are the things that you like about it?
I don't know, but I can share from this experience from being a person who was once on Medicaid and then being a person who have private insurance. I like my private insurance. I like when I go to the doctor's office, not being told, oh, you can't get this because you can only get this on Medicaid.
Are they limiting your medication?
Right.
They don't give you the good stuff.
I want the
they
good
say,
stuff.
go get some Tylenol.
Right. I even like that under like private insurance, like things that you wouldn't think is covered. Like under our insurance, a monthly massage. Sometimes I ain't gotta pay for
simple stuff.
Right.
Like stuff people don't really think about.
Right. Or things like, I'm a woman, so there's some products that I need monthly. That's covered under private insurance. Now, I don't remember if it was covered under Medicaid. Y'all will let me know if y'all are on it and, it's covered under. But, so just judging based off of those two experiences,
right?
Would my Medicaid experience be like that in the UK? Like what they have in the UK?
I remember them saying that in the UK, people are shocked that we even have to pay.
Right. Pay for
like,
ambulance and
why
things
y'all
like
have
that.
like even sitting in the waiting room? And we were talking about this earlier, even when it comes to births. So it's like you have to pay an arm and leg just to do the thing that's keeping the society.
To give you another citizen, I gotta pay.
To keep them
all
going.
This money.
But I know, like, it was not a broken bone. Every time I went to the doctor, I was told, you're healthy as a horse.
Right.
Go home. And I was so happy about that because I'm like, good. I mean, y'all don't got to find a reason to say I'm sick or I'm broken or something wrong with me.
More money this way.
Yeah, so.
Isn't there certain protections, but not all of them?
You actually do get health care if you're not a citizen. What about if you're homeless? Yes. Correct. What about specialized costs, or specialized care, like an inhaler or an EpiPen?
In the UK, for inhaler or prescriptions, and I'm just guessing, at the most $20. I'm guessing UK doesn't pay anything, which really sucks because we pay
A lot.
I would say it's probably higher.
Considering what it costs here, I'm gonna ballpark that at also another 25-ish.
Okay, it's actually £9 for any medication,
€9.
which is about $12.
Okay, so they are cheaper.
So they are cheaper. What do you think of that?
I am still for individual medical care.
Now I know we're on an
Roughly
EpiPen.
$600.
I know I have really heard some stories about how high that is. Anyway, but what I really love about healthcare in other countries is they don't have to pay to give birth.
Man, it's crazy. Like, we really got a price on everything.
Mm-hmm. And in some countries, they pay them for just having a child.
Yeah.
What?
Okay, so I ain't said this before, but I was really young. I got in a car accident, and I had to be pulled off in the ambulance. I thought the ambulance was a free ride.
Right, you just having fun.
They rolled me into the front of the medical center, left me strapped down, and the hard table on top of that was just so aggravating. I'm like, when they gonna come and get me out of here? Like, I felt like a crazy person being pulled into a house, you know what I'm saying? And they just let me, and I was laying down. I'm like, when they pulling me out? And then when they finally took me out, it's like, how you feeling? It's like, other than my back hurt because I left me here. Then they told me how much everything was gonna be, and they're gonna send it in the mail. And I'm like, so none of this was for free? I'm the one who's hurt.
Child.
So,
Listen.
but I was young,
I'ma
so
drive there.
I don't know.
Remember?
You need an ambulance? Nope.
Remember when we got in the accident and it was like, do y'all need an ambulance? Because we were genuinely hurt.
Busted up, yeah.
We were hurt. Even our children was in the car. They wasn't as hurt as we was, thank God. But it was like, do y'all want the ambulance? We was like, no.
No.
It was like, you sure? Because like,
can you drive? It's like, I'm gonna drive.
we're gonna drive. We drove so slow. So slow.
Yeah.
So have you ever avoided seeking health care or treatment or medication or any sort of health service because of the cost and you were worried about having to pay some sort of fee?
Yes, I have experienced that a lot with patients that come in with pneumonia but have been at home for a matter of 5 days and came in when it got worse and had to be admitted to the hospital. And we're like, why didn't you come in sooner? Well, I couldn't afford this bill, so I was trying to take care of myself at home first.
Even just at school, I know people who, let's say, don't have the student health insurance plan, won't go get, let's say, like contraception or things like that because they don't really want to pay for it out of pocket.
I found out later that I had sprained my ACL. I couldn't move, but I also didn't want to call an ambulance, so I couldn't afford it.
What would you do?
I got on my friend's back.
My sister, she has like a lot of allergies, so like instead of like using the ambulance for her like anaphylactic allergies, we have to drive her, which is very scary because you don't know about like traffic or anything. You don't have the same privileges as an ambulance on the road.
Have you ever not sought treatment because you're afraid
and
of
that's another conversation because you could be flying with your hazard lights on and the officer sees that. Now listen, if you're an officer and you watching this and you're not that type of person, then don't take this, it's not for you. But an officer will see that, pull you over and say, hey, you're driving too fast. Hey, we're in a rush. Okay, well, I need to analyze the situation before I could confirm whether y'all need to get somewhere, the time frame y'all got to get, because I'm the law.
Mm-hmm. And he's going to give you that ticket, then send you on by
the whole time, people up in this car going through some stuff.
For real? For real. That's why anytime I see somebody flying down the road, I'm like, they better be in labor.
They better be pregnant. They better be in pain. Somebody better be in emergency or something, because you got to get what you got to get.
But I think, like in our culture, right, we have a lot of natural remedies and, holistic measures that's our first go-to before it's medicine and then hospital.
Oh, we know our stuff.
Yeah, so
Yeah.
we take it. Listen, I cured. Is that the right word? Yeah, cured COVID. Okay, without going to the hospital. Because we didn't want no bill.
Man, what they at? They listen. They gonna come looking for
Oh,
you.
never mind. I ain't do
She
nothing.
got
I
the
just
cure
got
for
rid of
who?
the symptoms.
She got the what now?
I got rid of the symptoms, okay, within a matter of a couple days.
Somebody knocking.
I mean, just cut that part out.
No, you can't.
Lost.
No, ma'am.
Do you know anyone who has?
No, ma'am.
What about people who are afraid of the cost of, say, an ambulance?
Okay, that happens all the time because we have so many Americans that don't want to go in debt and they're trying to save money and they think they can go buy a car instead of an ambulance.
So what would you think if that service was free?
If that service was free, anything that's free, sometimes it's not worth having.
Girl, bring that ambulance on here. Somebody hurt that needs that free ride.
77% of people in Britain support the NHS and are happy with it. Would you say that you are happy with the United States healthcare system?
Girl.
Definitely not.
No, and I'm actually pretty lucky because I work for the university, so my insurance is pretty good. And even then, I'm not happy with it.
That's a loaded question. I have insurance, and it's good insurance through my husband's company, but we pay through the nose for it. If it were free, I would love that. And if we only paid $350 a month, that would be a huge deal.
I don't believe that our government should be responsible for providing all of us health care. I think the individuals need to be responsible. They need to have a job. They need to look for jobs that provide benefits.
There's so many people, especially people from sort of like lower socioeconomic backgrounds who can't get.
That's not everybody's ability.
It's not.
You be having people on a job selling insurance.
You ain't
Bro, hey,
You ain't lying.
I'm not lying.
You not lying.
I'm not lying. I'm telling you, I've been approached.
It's easier said than done. What if a person is only able to get a job? You know what? I was about to say fast food, but every time we go to like a McDonald's, they always have like now hiring. They pay for tuition. They pay healthcare benefits. So McDonald's is doing good. I don't know about all the fast, but let's talk about the people who are only able to get a low paying job. You think they're gonna have some benefits involved in that?
It's crazy
Like
because
you can't sit at the top and say everybody should have this. Every city in the United States is not equal. Okay.
And that's another thing I'd learned coming up when I was really young, that my first job didn't have benefits. I was just a worker.
Get your money.
If I slipped on the floor,
and
that
you
was
still pay
it.
taxes.
You know what I'm saying?
Yep.
I think them jobs all need to be in the same kind of loop
Now I do think
to be able to provide for their workers.
I was going to say that I was going to say that it needs to be mandated at the federal level that all jobs need to provide it, but not. Let's think about the small mom and pop shops. Like they probably only going to be able to afford 1 or 2 workers who's their family members if they have to provide.
Now, here's the thing, you know. When you're growing up, you have your doctor as a child. Some people just stick with that one doctor as a child. They family doctor from childhood all the way to a certain age because it cuts off. But to a certain age, they stick with that for as long as they can. And that transition now that you're working, then you're in this gap between not having it, and then you got to reset it as an adult. And a lot of times, that is where what she was saying. Well, everybody need to be able to know it's not going to be that simple for everybody.
Right. Yeah. Everybody has. No American is the same. Okay.
The health care that they need because they just can't afford it.
The premiums are still pretty high. They're not unreasonable, but they're still pretty high. The medicine I have to pay for is not covered that much, and it's not even anything crazy. It's literally allergy medicine.
Oh, wow.
And I still have to pay a fair amount every month for just allergies.
People are more than numbers, and they're more than, the change that you make from stiffing people out of their health care.
That is true. Boom, man. We're going to stop with that, man. Y'all know what to do. Go check the channel out, bro. But yeah, that's what it is. The the ability to have it and then be taken care of compared to trying to get into that game of being taken care of without doing it yourself when you don't really have all the resources.
Right. Now, there are some things, I don't know in the UK if it's giving birth free in the UK. I'm not sure, so y'all gonna have to let me know, fill me in, okay? But I do know in a lot of European countries, moms don't have that worry of a big hospital bill if they're going in thinking that they're going to have a vaginal delivery and then they end up in the OR. I've told y'all our story, right? Where they was trying to make me have a cesarean section and I ended up fussing with the people, baby. I didn't want that. Okay, so I'm in the OR. And I ended up being able to have a vaginal delivery. But guess what? I had to pay for both. Being in the OR and the vaginal delivery.
Can you imagine? They pulled my wife in the back and she's getting prepped up to ready, to do the pushing the labor thing while I'm getting suited up. As I'm getting suited up, I'm in this section of the hall and then there's a pathway this way. I see her being ran over to this direction. I'm like, what's going on? We got to rush her. The baby's not doing this. I'm like, what y'all talking about?
What are y'all talking about for real?
And it's all I hear is, I need my doctor. Where's my doctor?
Please,
because is your doctor, right?
My doctor.
Her doctor never came in yet. Mm-hmm. So it's funny now that I'm thinking about it, but at the same time, I was kind of like lost because they they made a decision and they was about to go through the whole procedure of everything. They had stuff lined up on the table. I'm like, yo. And, even if I wanted to, they wasn't going to allow me to do anything.
They were not listening to me.
Period.
They were not listening to me. And I value doctors. I value nurses. But listen to the patients. Because, baby, when my doctor came in at the 11th hour, she literally
walked in just in time.
They were already prepping me to cut me.
Yeah.
She came in and she asked me, Sierra, why are you hysterical? I say, I want to be given the opportunity to push. And she told everybody, stop. Let her push. And I pushed. She assisted me. And my baby came out.
Yeah.
Fine. Nothing was wrong with him. He came out screaming, crying. Ooh, anyway, Lord, the video done. We still talking.
We out.
All right, y'all. We hope you guys enjoyed this video with us. Be sure to subscribe. We'll see you soon.
Peace.